My vision for the outcome of the community of practice is that our system is going to appear seamless for families. Currently it is not so. Currently what families experience is oftentimes they have to do the solutions to the services because let's say there's an obstacle that their child has a certain diagnosis, and now they're discovering that even though they might know a family that receives the same type of supports and services that they feel that they really need, they can't receive it because of the funding structure. So I think within community of practice we have a wonderful opportunity here to make a seamless system. So to do those behind the scenes types of things that we as organizations, agencies, state systems need to do for families so that they don't have to do it on their own when they find out about these barriers that exist. They don't need to find out about these barriers that exist. We need to do that part for them, and we then get them connected to a very seamless, meaningful, appropriate forms of supporting their needs. In addition, I think that we really need, through the community of practice, to make sure that families don't feel the additional stress of the services and supports. It's important because oftentimes the structure, the current structure of families receiving services and supports often adds another layer of stress to their lives, which is unintentional. We certainly don't mean to be doing that to families, but we are doing it by making it so formalized that they need to figure out pieces that may not really meet their needs. They might be given services that they don't want. They might not receive services that they really need. So if we can really reduce that stress level, that makes for healthier families. And in the long run, that's what we really need to be focusing on, is how do we make these families feel really supported and emotionally healthy and ready to raise children that have disabilities and special health care needs, just like their other kids, to the strongest level possible so that they can be as independent as possible in the future. That needs to be our charge. How do we make that happen to strengthen that family bond?